This will be the last video in the Parenteral Dosage Forms series, and we're going to discuss the different types of tests we can carry out to determine the presence of pyrogens and endotoxins. There are three main methods, the two traditional ones being the rabbit pyrogen test and the Limulus amebocyte lysate test, and one more recent method being the Monocyte activation test. As always, before we begin talking about these methods, we need to first understand what pyrogens and endotoxins are, if they're the same thing or if they're different, and if they're different, then what's the difference between them? Pyrogens are products of metabolism originating from microorganisms, and more specifically during microbial growth. So the first thing that we learned about pyrogens is that they come from microorganisms when they're growing. Right. The reason why pyrogens are so undesirable, especially in pharmaceuticals, is that they increase the body temperature and therefore induce fever. They can also cause leukopenia, a deficiency in white blood cells, hypotension, and if taken in larger doses, can cause shock and death. So in summary, they can have lethal effects if administered into humans. Pyrogens can be divided into non-endotoxin pyrogens and endotoxin pyrogens, or simply endotoxins. So we can establish from this that pyrogens and endotoxins are not necessarily the same thing. It's more accurate to say that endotoxins are a type of pyrogen and that pyrogens is a more general term. By definition, endotoxins are lipopolysaccharides that constitute a major part of the cell wall of gram-negative bacteria, as represented in this diagram right here. Let's stop for a second. Is that to say that pyrogens can originate from any microorganism, but endotoxins originate only from gram-negative bacteria? Yes, that's exactly what I'm saying. And an important thing to note is that endotoxins are the most potent pyrogens, which is why they must be eliminated at all costs from our parenteral products. Generally, pyrogens are thermostable, meaning that they cannot be broken down through autoclaving. They are water-soluble, and they are unaffected by common bactericides. Notice that I just mentioned that they are not autoclavable. So was I saying that we can sterilize the parenteral product, but we can't remove the pyrogens from it? Wait a minute. Doesn't sterility mean pyrogen-free? No. Sterility is not the same thing as pyrogen-free. A sterile product is free from all living microorganisms, whereas a pyrogen-free product means that it is free from any pyrogens that might be present even after the microorganisms are killed through sterilization. Don't make the mistake of thinking that if a product is sterile, it is pyrogen-free. No. Even if the microorganism itself is killed, its fragments may still remain. So that's why a solution or material that passes a sterility test might not necessarily pass a pyrogen test. So where exactly might pyrogens be present in the pharmaceutical preparation? They might be present in the solvent, the medicament, the apparatus, or they might develop due to the method of storage. But usually most pyrogens are found in the solvent. The first type of pyrogen test that we're going to talk about is the rabbit pyrogen test. The way this test works is that we gather 3 rabbits and we put them in a cage to keep them in place like so that we can conduct the test on them. The parenteral product we want to test for pyrogens is injected into the ear vein of each of the 3 rabbits, and they are left for a certain period of time after which their body temperature is recorded. You might be wondering, why do we conduct this test on rabbits and not other subjects like rats, for example? It's because rabbits have a similar increase in temperature in response to endotoxins as humans do, which makes it easier to predict the complications that might occur to a human patient if they were injected a parenteral product not completely rid of pyrogens. Let's suppose that the product we injected was pyrogen-free. The observations we would make would be that each rabbit does not exhibit an individual rise in temperature greater than 0.6 degrees Celsius. and that the total temperature rise of all the rapids together does not exceed 1.4 degrees Celsius. If these observations were not recorded, then we would need to double check again to confirm that there is no error in the test results. So another 5 rapids are gathered and the same procedure is repeated with them. If each rapid does not exhibit an individual temperature rise greater than 0.6 degrees Celsius, and the total temperature rise of all the rapids together does not exceed 3.7 degrees Celsius, then we're in the safe zone and the product is considered pyrogen-free. If these observations are not made, that would mean that all the 8 rapids show pyrogen-induced symptoms, the test has failed, and hence we need to remove the pyrogens from the product and redo the test. Although this is the traditional method for pyrogen testing, it isn't used as much nowadays due to the ethical issues that arise with using animals for pharmaceutical testing. It has already been largely replaced by the Limulus amebocyte lysate test, which is the next test we're going to talk about. The Limulus amebocyte lysate test, or LALS test for short, derives its name from the subject of the test, the horseshoe crab. Let's break up each word in this test so that we can better understand what we're dealing with. Limulus polyphemus is the Latin name of the horseshoe crab. Amebocyte refers to the cells in the blood of the horseshoe crab. And lysate is a solution made from the lysed amebocytes. For this test, we use the lysate of the horseshoe crab amebocytes to test for endotoxins by incubating the lysate with a sample of the product we want to test for endotoxins. Even a small concentration of endotoxins in the product will cause the lysate to clot, forming a gel in a coagulation reaction. This test is preferred over the rapid pyrogen test if we want to identify and target endotoxins, as it is more sensitive to them. However, its downside is that it only detects endotoxins and not non-endotoxin pyrogens. There's actually another method that outshines the previous two. It's called the Monocyte activation test. Due to the ethical issues that arise with rapid pyrogen testing and the limitation of identifying only endotoxins with the LAL test, this method is quickly becoming the newest go-to method for testing for pyrogens in pharmaceuticals. According to the European Pharmacopoeia, there are even plans to discontinue completely the rapid pyrogen test, and this is the test which will most likely replace it. The monocyte activation test is built on the concept of detecting substances which induce monocytes to release pro-inflammatory cytokines. It plays on the concept of mimicking the immune response. Just like humans react to pyrogens by releasing cytokines and developing a fever, a sample of monocytes react to pyrogens by releasing cytokines as well, which are counted using the ELISA technique. The procedure that we follow is that the sample of the product we want to test for pyrogens is incubated with either monocytes alone or with whole blood containing monocytes. In presence of pyrogens, monocytes will release pro-inflammatory cytokines, and the amount of cytokines released is quantified using techniques such as ELISA. The higher the cytokine levels, the higher the pyrogen levels are in the sample. And this is the most likely test to replace the rapid pyrogen test in the very near future. To end this video, I want to summarize what we just learned in this one sentence. All methods that detect pyrogens will also detect endotoxins, but endotoxin-specific tests will not detect the presence of non-endotoxin pyrogens. So the rapid pyrogen test and the monocyte activation test detect pyrogens, but the Limulus amebocyte lysate test detects endotoxin pyrogens only. And that will be all for this video.